Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with the January 7th, 2021 update and a belated Happy New Year from the Dubuque County Public Health Incident Management Team. Dubuque County's COVID-19 case total is close to 11,000 cases, with 446 cases reported in the last 14 days. All age groups are having new cases. And the 19 to 24-year-old age group continues to have the highest number of cases, accounting for 9% in December, while the rest of the cases are fairly even distributed in the adult populations. Overall, Dubuque County's community spread decreased significantly between November and December. In November, there were 3,538 cases, while December had just 1,341 new cases. Even with that, our 14-day average positivity rate has remained steady at about 11%. This sends the message that we all must continue to wear masks, social distance, and practice all the recommended public health measures that are now part of our daily lifestyles. Local and state hospitalizations have increased slightly, and those over 50 years of age are hospitalized more than the rest of the population with COVID-19. And of the 140 Dubuque County residents that have died from COVID-19, 137 had pre-existing conditions. Iowa is now receiving doses of Pfizer and Moderna vaccines, and healthcare worker vaccination is underway for our healthcare workers here in Dubuque County. Vaccination of healthcare workers, along with residents and staff at our nursing homes, will take most of January. That's because as we receive weekly allotments of vaccine from the Iowa Department of Public Health, we are working to not only vaccinate doctors and nurses in our hospitals and medical clinics, we also have to vaccinate the staff in those facilities that have patient contact, along with emergency medical service workers, or EMS, dental and eye clinic offices, physical therapy, home health, and others. Dubuque County is doing a great job of getting vaccine into our healthcare providers' arms, with well over 80% of our vaccine administered. But it's still going to take several weeks to complete this 1A priority group. So what about the elderly? Your grandmother? Your parent with a chronic disease or condition that puts them at risk? What about our critical workers in factories and food production? And all the other police officers and transportation workers? The incident management team is planning for these groups, but the Iowa Disease Advisory Council will be charged to develop recommendations for Iowa's priority groups. This council, appointed by the Iowa Department of Public Health, will develop recommendations for vaccine prioritization within the other populations of crucial infrastructure workers and people at increased risk for severe COVID-19 illness, along with the other groups I just mentioned, all while developing priority subset groups that promote public health and enable social and economic activity. The Iowa Infectious Disease Advisory Council is meeting regularly to name these priority groups, all in tangent with how much vaccine Iowa is receiving from Operation Warp Speed. Sound complicated? It is, and that's just deciding on the priority groups. Our incident management team is also charged with deciding who administers the vaccine and to whom locally, all while not knowing exactly how much vaccine our county will receive each week. So what can you do as you wait for your turn to get a vaccine? Continue to be safe, wear a mask, and not put yourself in risky COVID transmission situations like crowds or groups of households mixing at gatherings. Please do not call your doctor or clinic. They don't know when you will be eligible either. As each priority group is rolled out, we will do a lot of public information and social media broadcasting about how and where to get vaccinated, along with who is eligible. And speaking of not putting yourself in unsafe situations, just because our cases and community spread are lower than they were in October and November doesn't mean we should let our guard down. We've been through this before. We've had initial waves in April, followed by one in July, and repeated even worse with the one this fall. Throw in the new variant strain of COVID-19, B117, which is now in the U.S., and more of those are being discovered, by the way, and also the record-setting travel, along with severe surges in other parts of the country over the Christmas and New Year's holidays. The next couple of weeks will reveal our ability to maintain our lower community spread levels and not have another surge here in Dubuque, Iowa, and the upper Midwest. So as we settle into January and winter, let's not grow complacent. I know without a pandemic going on, winter can be long, cold, and seem to drag on forever. So we need to work on our resiliency. Make some plans for what you can do during January and February as we patiently wait to be vaccinated. So if you didn't get your closets cleaned out and your home organized back in March and April, like me, now's a good time. And it's also a good time to focus on your lifestyle habits and how they affect your health and wellness. Set some realistic goals for your diet and nutrition, exercise, sleep, and decrease screen time, just to name a few. Maybe now's the time to try that new hobby, craft, or project you've been tackling. Working on any of these things may improve your mood, productivity, and just your general ability to cope, especially with everything going on in our country right now outside of the pandemic. We need to nurture our brain health. Luckily, our January weather has been warm enough and with enough snow to do some outdoor winter activities. This is the part where I give you a pep talk about getting out over the weekend. Being outside while keeping your distance is a way you can actually spend time with friends and neighbors in a safe way. So this weekend, take a stroll outside if you're able, make a driveway chat or hot chocolate date. Better yet, reach out to someone who is alone or struggling, because we're all in this together.